Hi guys, I'm Dr. Paul Hodgson, and I'm here to teach you a little bit about stress today. So stress comes in three forms: physical, chemical, and mental emotional. Most people, when they hear the names, or when they hear stress, they think just about the mental emotional side of things, and also about things that are outside of your control. There's two forms of stress: eustress and distress. Okay, so eustress is actually good stress. It's like going to the gym and stressing your muscles, going home and recovering, and then you slowly get stronger over time due to that stress. Distress is stress that's too intense, the body can't adapt to it, and it actually breaks down. So there's stress that's good, and we don't want to remove all stress from this world. What we do want to do is we want to increase our ability to deal with stress. We don't want to make the job easier, we want to make ourselves better. So we created this little model to help people understand how stress affects many different conditions. And the name of our practice is actually Stress and Pain Relief. That was really intentional. Most people come in, I would say, for pain. But we start to help them make the connection between the stress and their pain. So most people think that I just bent over to tie my shoe and my back snapped and I just don't know what it is. But if we start to dig into their history, we might also find that they were having trouble at work, finances are stressful and tight, maybe a relationship is not going so well. So there may be all these things at once. And oftentimes the back seems like the issue, but when we address the underlying cause, the stress, then the back can heal really rapidly. And if we fail to address the stress, oftentimes the back won't heal completely, or it'll get better, but you'll be setting yourself up for another injury. So we drew this to kind of show you, so stress, it varies throughout our life. Take care of some things, take some things off your plate, stress goes down. Eat some crummy food, chemical stress goes up. Drink some alcohol, chemical stress goes up. So we're always in flux, and we're always a mixture and total stress of our physical, chemical, and mental emotional stress. They stack up on top of one another like this. This line right across here is what we call the threshold of symptoms. So people come in when their stress gets above the threshold of symptoms. And then oftentimes they leave when their symptoms go away and they get below the threshold of symptoms. So our goal in this practice is to help you identify the mental, emotional, chemical, and physical stresses and get you so far away from that threshold, that line of symptoms, that even when life throws you something that you're not thinking or not planning on or not accounting for, that you can totally handle it and it doesn't send you into a spiral of symptoms, pain, and problems.